Hi mamas, welcome to Beyond Birthing. This video is part of a series of videos about manual pressure points to help decreasing pain during labor. In today's video, I'm going to show you the double hip squeeze. If this is your first time here on this channel, make sure you subscribe and press the bell button below so you don't miss anything. So for all the manual techniques I'm going to show you in this series of videos, we will always have two goals in mind. The first goal is going to be opening the pelvis for birth. And the second goal is, of course, relieving pain during labor. So let's get started with the hip bone squeeze. So what we're going to do here is put our hands on the top part of the hips. So right here. And we're going to open the hips like this. It is a technique that in theory should be used more so when baby is lower into the pelvis. So when you're starting to feel more pressure down into the pelvis, because that's exactly what the bones need to do at that point, is they need to open that way for baby to move down towards the pelvic floor and the vaginal opening. However, as I always say, rely on the pregnant person's pain. So if the pain decreases with the technique, it's a good sign that it is what you should be using at this moment. So there's a few versions that I want to show you. The first version is we're going to use our hands. So first, start by feeling where her hip bones start. So here it's nice and soft. Oh, hard. So that means I'm on the crest of her hip bones. And I will want to be a little lower than that, I'd say 1 inch below, to be on the plateau where it feels more comfortable to apply pressure. So right on that flat part here. So I can go and apply pressure on both sides, and I'm going to bring the hip bones together is essentially what I want to do. And so like this. Does that feel right? Mm-hmm. So we don't want to be pokey with our hands. If it is, then try to spread your pressure nice and even on your hands. So that's version 1. It's really exhausting for the birth partner. So unless you're really, really strong, I would say this is my least favorite version of the double hip squeeze, but it's nice to have different alternatives, so I wanted to show you that one. The second version, we're going to use our biceps muscles. So I'm going to get real close from you, Lenny, here. But I'm going to go around and put my hands, like kind of hold my wrist with the other hand. And I want to be off her belly bump, obviously, because we don't want to squeeze baby. And then I'm using my biceps to squeeze that same part of the hip bones. What I like is I can use my wrist to kind of do a lever here to help applying more pressure. And it's much less bony to use our biceps versus our hands, so it's probably more comfortable to you.
Yeah.
And do you feel like there's more pressure that way versus the hands?
There's more strength.
Yeah, there's more strength, and I'm working much less. Like I could just hang out here forever, and I mean, not forever, but for a minute or so for sure. Okay, so that's version 2, and I want to credit Justin from my prenatal class, who's a birth partner, and he was like, what about I use my arms? And I was like, sure, let's try it. And it's been like the favorite technique. Almost everyone love it. So thanks, Justin. And so the third technique is using a scarf. And we're going to put it around her hips. Again, we don't want to compress baby. And we're targeting to go at that same spot as we were before. So I'm going to make sure that it's on that plateau on both sides. And I like to have it nice and wide, just so it's not like super pokey when it's thin. And then I can just give it a nice snug. And I start basically just twisting the scarf to compress the hips. And you tell me when that's enough.
That's good.
That's good there. So basically you just hold that for the whole contraction, which is really easy for the birth partner. It's a technique you can use in other positions as well. So if she was standing, you could use it. If she was sitting on the ball, you could use it as well. So very, it's just a nice technique that you can use in various situations. I like to use also the tourniquet technique to twist my scarf. If you've done any first aid course, you probably saw that. But what I do is I put a pencil or a marker in the middle here. And then I can make a knot, and I just use the pencil to twist, which is easier to keep the pressure nice and steady with this technique. And the other version for her to be independent is to have the scarf just kind of twisted at the front over the pubic symphysis, and she can twist it herself in that case. It's good to have some independence. There you go. The last version is using the inside of our knees. So I'm going to step over Lenny and put my knees on her hips, and then I'm simply squeezing her hips together with my knees. I can even have my hands underneath if my knees are too pokey or too bony and she feels uncomfortable. And so I'm just using my knees to help my hands to press the hips together. So for this technique, again, as any other manual pressure labor technique that I'm showing you, you want to do it throughout the contraction. So there's no point to do this in between contractions. And how you'll know that it's the good one to use at that moment is that Lenny will report that it decreases her pain, simply, right? We don't want to do anything that increases the pain. They have enough pain as it is, so we want to make them feel better. Once you have tried your double hip squeeze, let me know how it went below and let me know which version you connected most with. I'm really curious to know what you guys preferred. And on that note, I'll see you later in another one of my videos. Bye guys!